NEET PG preparing students, those who are watching you, any last minute tips?
Now that, the exam is just 4 months away, rather than running after a lot of material and having a FOMO of a lot of other things that others are doing, focus on repeating and repetitions of what you've already done. Because 19 subjects is no joke. You need to keep it in your mind that there's no second chance.
So why did you take the FMS path?
Right after MBBS, it settles you down. It gives you the rank of an officer, your accommodation, your food, your salary, and most of all, it gives you an overall personality development. So in the army, you are a doctor, that is number 2. Number 1, you are an officer. It is very important to be an overall developed person rather than, just being a doctor.
Not rushing into the MDMS after the MBBS, choosing the Armed Forces Medical Services over the usual medical route and now stepping into the mentorship. This isn't the typical journey most doctors take. But why? What made you choose this path? Today, we have Major Dr. Birsukhman Singh, an ex-Indian Army officer who has got All India rank of 1312 and rank 1 in Armed Forces Ex-Service category in NEET PG 2024. So he is with us to share his experiences, challenges and lessons. So let's start. Hello Birsukhman, how it's going, and has your residency started and where have you joined?
Good afternoon, sir. Thank you so much for having me on the show. I'm doing pretty well, sir, and I hope you're doing well too. Yes, sir, I've started my residency. I'm MD Dermatology resident at Indira Gandhi Medical College, Shimla.
Yeah, it's inspiring to meet doctors like you who choose to pursue their dreams instead of following the usual path. So let's start with your NEET PG preparation journey before diving into your pre and post MBBS life in the army. What led you to the AFMS and what were the biggest challenges and lessons along the way? 6 years away from the books, then straight into the NEET PG prep. How was that?
So, sir, in the Armed Forces Medical Services, all the Armed Forces officers are entitled to pursue post-graduation after 4 years of service. But the officers that pursue MD in the Armed Forces colleges during service, they're entitled to a bond as well of 7 years. So either that is one path that you can take, or you can choose the ex-serviceman pathway, wherein you resign from the services, you still retain your quota, and you can do your post-graduation from the Armed Forces colleges as an ex-serviceman, as well as, if you get a good rank, you can always pursue your post-graduation from any college in the country. So I had, always decided that I wanted the ex-serviceman category, wherein I'd already gained all the experience from the armed forces. And life after specialization is pretty much the same as a specialist inside as well as the outside. So that is how I chose the ex-serviceman category as an option.
So do you have any I can't do this moment during your preparation? What were your challenges?
So that exactly was the reason that I got, this rank, maybe because I never had that question in my mind that, I can't do it, because, keeping the, time frame that I had in mind, after so many years of MBBS and, at this age when I wanted to pursue my post-graduation, I never had this thought in my mind that I will have a second chance. So this thought was throughout with me in my preparation that this is the first and the last chance that I have. And I think that was one of the biggest factors that led me to, this success at the end.
Okay, nice. Then any lessons from the army services that help you in your preparation?
In my preparation, yes. I think somewhere or the other, the army makes you a lot of, gives you a lot of discipline in your life. So I think somehow I was able to follow the schedules and timelines that I used to make for myself, because somehow over the years, the discipline just gets inculcated into you. So when I was actually preparing, I think I was able to follow my schedule and my preparation, because somewhere or the other, that discipline that had been, inculcated into me helped me out. And I think also the major factor that the armed forces brought into me during my preparation was the mental strength that it gives you. So a lot of students during their preparation, they break down and they have a lot of bad days. And how to go through those bad days and how to handle those tough times and the bad test results during the process is something that is very important, because I think at the end of the day, these competitive exams are more about, how you go into the exam hall and your mental strength on that day rather than what you've studied.
So post MBBS, you had the usual PG routine in front of you. So why did you take
Yeah.
the FMS path?
Yeah, so I think the Armed Forces Medical Services offers not only the opportunity to do post graduation in the long run. It gives you a lot of avenues. It opens up a lot of avenues for you. So right after MBBS, it settles you down. It gives you a very good salary. It gives you everything that your family or your parents would desire. It gives you the rank of an officer, your accommodation, your food, your salary. Everything is settled down, and it is a very safe environment because it offers you free health insurance. It gives you security in terms of job as well as further studies, and most of all it gives you an overall personality development. I think that is very important, because we were kids, just 17, 18 when we entered med school, and then suddenly we get into post graduation and we come out into a world where we've not been exposed to as doctors.
Yeah.
So in the army, you are a doctor. That is number two. Number one, you are an officer. So you deal with all kinds of people around you. You face, all kinds of situations around you. So that gives you an overall development. And I think when you come into the circle of life in the outside, it is very important to be an overall developed person rather than, just being a doctor.
So did you also face resistance from your family and friends? How did you deal with that?
Oh, yes. So my parents are also doctors, so they were pretty surprised with my decision. But somehow, having heard all the good things about the army from a lot of people and, relatives who were there in the army, they were pretty confident that, I'll be safe and sound there. And I think as a parent, that is what matters. So they supported me in my decision. But yes, they were surprised at the beginning when I chose this path. But throughout this journey, I think they've been involved in almost every step. They used to visit me wherever I was posted. They enjoyed a lot of perks and privileges with me. Even they got to, enjoy the benefits that you enjoy as an officer in the army. So even they have, had a great time with me in this journey.
So could you quote some benefits which everybody should look for it?
Yeah. So as an army officer, I think, when you enter the cantonment, you just enter a totally different world that is there inside India. So in your own city, when you enter a cantonment, I think the cleanliness that it offers, the clean air and environment that it offers, the amount of respect that is there around you. Everyone is very soft spoken, respectful, and, even the army patients and doctors, they just have a very special bond, and it is very different from the civil environment. So, I think that is a huge benefit, because as doctors, when we are facing so many unsafe situations in this country right now, the army is just on another level, wherein the hospital environment, the doctor-patient relationship is really respectful and pure. So I think that is one of the biggest benefit, that you feel very safe as a doctor and you have a very special bond with your patient. Apart from that, army offers a lot of luxuries that come with it. I'll not call it financial luxuries. I'll call it, luxuries of life, because there is, this space in the army environment wherein you're always free to, approach anyone around you for help. You can always, you can always expect your seniors and juniors to be there for you. And I think that is a very special thing that we are slowly losing in the civil society, but it is still present in the army.
So looking back, what's the biggest thing AFMS gave you that present PG wouldn't?
So I think the biggest thing that I got from the army was this only, that it inculcated a lot of discipline into me. And it made me, a person who can handle tough situations and bad times, with a lot of ease. And I think that is very important when you step out into the civil world.
Okay, so if someone want to join the army medical corps, so how it would be possible? Like if the AFMS is the right career choice for them?
Yeah. So there are two pathways if you want to join the army as a doctor. One is right after grade 12, you can give the exam and join the AFMC for your MBBS. If you do that, then you straight away get the option of joining the Armed Forces Medical Services right after MBBS. But if you've graduated from anywhere else in the world, be it a FMG student or an Indian graduate, you can always give an exam of the Armed Forces Medical Services, which is right after MBBS, and it happens almost once or twice a year. So you have to follow their website for updates, and you go there. There's an interview which is done by a board of specialists and senior officers. And then there's a medical and fitness test, which takes about 2 days. And then you undergo the army training, which is more of military training and very less of, medical training. And that's when you get, that's when you become an officer in the army.
So, can you just help other students who want to join the Army Medical Corps, telling them what all those things matters while going for the interview, and how your interview went in that situation when you have applied for that?
Yeah, so I think the Army selection interview looks for a lot of officer-like qualities. So they are called OLQs, and I think those qualities matter a lot because you're not just a doctor, as I said before. You are an officer, and you need to command men, and you need to take a lot of decisions there. So that interview, you need to walk in with a lot of confidence. And they are looking for you being very robust and mentally tough, because they would like to ask you questions which are not only related to medical science, and they would, give you a situation maybe and ask you how you would approach it. And they are seeing how you're sitting, how you're talking, and, if you're feeling the pressure or not, because they want you to be ready for what you're, going to get after you get into the army. So I would suggest any student who's interested to make sure they're well dressed. They walk in with confidence. And even if they don't know an answer to a question, they should, confidently answer that I'm not aware of this and I'm ready for my next question, because they don't expect you to know everything, but they expect you to be confident about what you know. So I think that would be a tip that would help a lot of students.
Okay, that's nice. So, how many professors will be sitting in the panel of interview?
Usually there is a panel of about 8 to 10 officers, and most of them are of different specialities. Sometimes they have a psychologist as well. And one of them is a general rank officer, which is a very senior officer. So the different specialists would like to ask questions about their own specialty questions. And the general officer would maybe ask you questions about you and situations. And usually the psychologist, if present, he's just observing you and your confidence.
So many MBBS graduates fear stepping off the usual track. So what's your take on that?
I think it is very important, to start this movement wherein doctors need to understand that, as a doctor, you need to be an overall doctor first, rather than just stepping into specialization and, following the cliche pathway. This is very stereotypical of us to think that, if I'm, for example, an ophthalmologist, I only know things about the eye, or maybe I'm an orthopedist, I would only know things about bones. So, but when our family needs us or our friends needs us, or, as a layman, if somebody approaches you being a doctor, I think the basics of medical science practically should be a part of a doctor's life. And in MBBS, I personally feel we do a lot of theory, but somewhere internship is too less of, a practical life experience for us to be trained to, do the basics of a doctor. So I personally feel, some kind of house job or some kind of work as a doctor is very important, to become an overall doctor. And then, of course, your specialization is definitely something that you will step into. So my take was always a little different from the, usual pathway, because I personally feel when your family and friends need you, they wouldn't ask you what specialization you have done. And they would expect you to give them, the best advice or the best treatment at that time.
So do you want to share anything that what you have achieved during your army journey? Anything you want to share with us?
Oh, yes. It's pretty interesting to know that, even doctors in the army can, indulge themselves into all sorts of extracurricular activities. So during my tenure, I was posted a lot of my time with the Armored Corps. So I got to undergo the Armored Corps tank training and, tank firing and missile firing myself. And I underwent courses for the same as well. So I think it's very interesting, if you're a doctor, but you know how to drive a tank or you know how to fire a tank. So that is an experience that money can't buy. So, and, apart from that, I think I was posted to places where I think human civilization won't be even allowed to go to, in Eastern Ladakh, where it is minus 45 and there are glaciers around and you can, actually serve for your country at such places. I think it's beautiful experience for a doctor to be, learning things, because those things you can only learn and, experience if you're there. There are things you can't learn from books, you can't learn from YouTube and videos. So I think the army offers you opportunities to, experience things which are priceless.
Okay. So how many awards you got?
Oh, so my uniform was, pretty, modestly decorated, I'll say, for a rank of a young major. So yes, I had 3 medals and two training batches as well on my uniform. So I think within the service that I had done, I think that was pretty great.
Yeah, that's a nice and nice story. So now that
Yeah.
you have been on both sides, like what is your advice for both NEET PG and I9CT preparing students?
My personal advice to students in NEET PG and INICT preparation would be that the first thing that you can learn from me is that you need to keep it in your mind that there's no second chance. Because, when we walk into these competitive exams, most of us feel that, dropping 1 or 2 years is okay, but it's not. It's a matter of your life and it's a matter of time that is very precious. So I think you should walk into that preparation thinking that there is no second chance. That is my message to you. And if you keep that in mind, I assure you, you will retain things that you study. You will, walk into that exam room with more confidence, and you will not give up on the days that you're not feeling confident. Because on that day, when you're not feeling as good as you should be, you will tell yourself that this is my only chance. And then you will, start again and you will feel better.
So do you think that having mentor in our life is very important and how it influence our journey?
Oh, yes, absolutely. In fact, if I had not come across people who were doctors from the army in my MBBS days, a lot of my professors in my college were from the army. They were retired brigadiers and colonels. And in fact, one of the plastic surgeon in my college, he was ex-general from the army. So I think their life stories and their experiences mentored me into my pathway. And even now I feel in this NEET PG preparation as well, mentorship was a big, reason that I became successful in my NEET PG score. So I think somebody to guide you on the right path really makes a difference.
Okay. So in the last, just one question for you, like NEET PG appearing students, those who are watching you, any last
Yeah.
minute tips that you used to do your preparation days to motivate yourself?
Yeah. So now that, the exam is just 4 months away and, it is a very crucial part and time of your life, I would suggest you only one thing. Rather than running after a lot of material and having a FOMO of a lot of other things that others are doing, focus on repeating and repetitions of what you've already done. Because I think when you walk into the exam hall, being confident about what you know, that is much better than knowing a little bit about everything. So my tip to everybody who's preparing is that just do what you've already done again and again, because 19 subjects is no joke. It's, 3 hours and you have to, reproduce everything that you've studied. So if you've done it multiple times, only then you will be able to, confidently answer questions over there.
Okay, so thank you so much for joining us, and I hope those students gonna listen. You definitely gonna get the motivation what they want in your life, and the choosing the different career path will be easy for them after listening to you. So all the best for your residency, and hope you're gonna do very well in your life.
Thank you so much, sir. So
Yeah.
kind of you. Jai Hind.